So if you've got an upcoming interview for either a healthcare assistant job or a senior carer job, this is the video for you, because I've put together frequently asked questions together with sample answers, and this is going to help you pass your interview. So one of the most important questions that you will not miss in any interview is, tell us about yourself. So this is how you can go about answering this question. My name is Diana. I currently work as a care assistant, and I have 10 years of care assistant or nursing experience, during which I've been actively involved in caring for patients across all ages, most especially the elderly who are most vulnerable. This has broadened my knowledge and experience and exposed me to the basic principles of elderly care, such as optimizing nutrition, ensuring safety, and safeguarding. This knowledge and experience will therefore be transferred to this similar working atmosphere to aid in smooth running of activities to achieve the expected goals of this organization. So this is quite a simple and model answer for when you are asked, tell me about yourself. So you can use it as a guide and then chip in whatever you've also got to add. The next question is most likely to be, why have you applied to work as a healthcare assistant or as a senior carer? So a model answer will be, I've worked in a similar role for 5 years, and I get great satisfaction from looking after people, especially those who are vulnerable and need support. Having worked in a similar role, I believe in my personal abilities, and I'm confident that I will excel in my role and also contribute towards the success of the organization. The next question they might ask you is, why do you think you are the right fit for this job? So this is a model answer for this question. So having been in a similar role for 5 years, I confidently believe that I have an immense level of experience in this role, and I'm able to assess and identify the needs of my clients and provide the needed support promptly. So you can also add this, I've got good communication and interpersonal relation skills, making it easy for me to escalate the needs of the people under my care to the multidisciplinary team to ensure better health outcomes. I'm hardworking, flexible, and I'm able to adapt to various situations and working conditions. Lastly, you can say that these are qualities I possess. Also, my personal values are in line with the values and standards of your organization, and this, I believe, makes me the right candidate for this job. So considering what I've just said, if you mention that your personal goals or your personal beliefs are in line with the standards and the values of the organization, make sure you go onto the website of that organization and read a bit about their values, their vision, their aim, and all that, so that at least they will know that you've done a bit of research about the organization. That will make them know that you are really keen to work with them. That will give you an added advantage. Another important question you might be asked is, what is safeguarding? Safeguarding is a vital process that helps protect children, adults from abuse, neglect, and harm. It's the duty of every member of staff to safeguard both the staff and patients, and to provide the right services to those who are unable to protect themselves from abuse, harm, and neglect. As I go about my duties as a carer, I will ensure patients under my care are well protected. If I suspect for any reason that a patient under my care could potentially be abused, I'll raise a safeguarding concern by escalating it to a senior member of staff as well as my line manager. So by saying this, you've explained what safeguarding is, and you've also explained what you would do in case you realize that you suspect anybody under your care could be under any form of abuse. So this will give you more points because you've explained it and you've told them what you would do in case somebody under your care is potentially being abused. Another important question you might be asked, what would you do if you find a patient under your care unconscious on the floor, or if you find that someone has collapsed? What would you do? So I will start by saying this. If you find an unconscious patient, the first thing to remember is not to panic and to keep yourself safe. I will check the surroundings to see if it's safe to go near the patient. I will then try to arouse the casualty by giving them a hard shoulder shake to call their name, just to see if they would respond. That's the purpose of you shaking the person. The third point is, if I get no response, then I will shout for help and do a quick ABCD assessment. Mentioning this ABCD will actually give you additional points. I will tilt the patient's head backwards to help clear their airway and check for signs of breathing by looking up for the rise and fall of the chest. If they are not breathing, I will start chest compressions immediately on patients who are for resuscitation. So another question you could be asked, what would you do if you come across a patient who is aggressive or confused? This is a model answer for such question. As the saying goes, two wrongs cannot make a right. In order to handle an aggressive patient or confused patient, I will use a client-centered approach by performing a quick risk assessment to explore the cause of the patient's behavior. I will remain calm, remove them from the situation or from the environment, listen to their concerns, reassure them and acknowledge their grievances. I will then give them the opportunity to explain what has angered them or made them upset. I will also seek support from the members of staff as well as family members to get more information about the patient and how to make them more comfortable. I will also escalate this to my line manager, document the incident in the relevant paperwork and complete an incident report or a DATEX. The next question is, how would you perform a client's needs assessment? A health needs assessment is a systematic patient-centered approach used in identifying the health and care needs of a patient and putting together the necessary measures or plans in place and also making every effort to meet these needs. I will do a patient's needs assessment by first doing a thorough risk assessment to identify the patient's functional needs as far as the activities of daily living are concerned. This will enable me liaise with the multidisciplinary team to get the necessary support that meets the patient's needs. So the last question I would like to address is, what will you bring on board? I will act as an advocate for my clients under my care and ensure their concerns and safety is prioritized. I'm a good team player and I do work efficiently as part of a team. Having had 5 years of experience as a carer, I've had the opportunity to be in charge, coordinating activities and supervising other carers. With this experience, I'll be able to take charge and coordinate my team to ensure smooth running of daily activities within the unit. This is a fantastic answer for such a question. And if you mention the word team player, that is one word they are always looking for, because you don't work as an individual, as I've mentioned before, you always work as part of a team. So they want to know somebody who can easily fit into a team and contribute their part towards whatever is needed to be done for the patient. So I hope you will take note of all these answers to the questions I've discussed, and if you come across any of them in your interview, I'll be very happy if you could let me know so that it will motivate me to do more. And please don't forget to share this with others. So I'll see you in another video. Bye.